is very likely you know someone who is enduring the growing epidemic of drug addiction. With millions of people being affected in the U.S., it is becoming too common to lose loved ones to addiction. Doctors need to be trained and monitored to make sure they don't overprescribe drugs. In this speech, I will be talking about the growing drug addiction, the solution we can have, and what the consequences will be if we don't act fast. Now that we have seen the problem, let's go on to really analyze prescription drug abuse. It is an epidemic that is growing at an alarming rate, and we need to move fast in order to fix the issue. Statistics show that an alarming rate of increase has happened throughout the last couple of years. According to the NIDA, it has increased by more than 132 million people since 1991. Also, according to the NIDA, opioid prescription has been given to pregnant women at a 14.4% increase. This is extremely harmful because opioids are harmful to the fetus and can cause neonatal absence syndrome, which has increased by 300% in the US since 2002. Also, an alarming amount of overdoses were caused by prescription drug abuse. The NIDA reported that the number of unintentional overdose deaths from the prescription pain relievers has soared in the US, more than quadrupling since 1999. According to physician Reeves from the journal Prescription, the number of overdose deaths from painkillers in the US is higher than the total number of deaths from heroin and cocaine combined. It is truly disheartening to see loved ones going through prescription drug addiction and its side effects. According to Felicia Reynaldo, extremely slow breathing, decreased consciousness, and abnormal behavior are some of the effects that are apparent with the addiction. This side is heartbreaking because people become shells of their old selves. Now that we know what the problem is, we need to understand how we can go forward and solve this. In order to fix the issue of prescription drug addiction, we have to go to the source. We need to make sure doctors are properly educated in pain meds and how to manage chronic pain. The first step would be improving education of pain management. The Journal of Pain, according to the Journal of Pain, medical schools spend an average of 9 hours on pain management in the entire curriculum. According to Firth, lack of education has caused millions of deaths. Courses should be longer and should show how to manage pain. Law increasing the courses would significantly help this cycle. We need to enact laws that ensure prescription drug monitoring programs are in effect. There is a discrepancy between states. In addition, there needs to be a federal law that enforces and limits the supply. There should also be an automatic report when a patient has been on medication for an extended period of time. The law would give doctors a detailed report of the patients and what they are. This would lead them to make better decisions according to the patient themselves. There has already been a law enacted in Florida, according to Chang-Ruck law. Physicians need to make reports on specific people. This has already helped drop overdoses and the amount of drugs dispensed. Now that we know the solution, we need to understand that we need to act fast. Better education will save lives and stop the reoccurring cycle. Lives will be lost if nothing is done. Are simple laws worth saving and reports worth saving lives? In conclusion, prescription drug abuse leads to death and tragedy. We need to stronger laws to stop this. If we don't, lives will be lost. I'm sure you know someone. If you ask yourself, I'm sure you know someone that is going through this addiction, and you need to ask yourself if they are worth saving their lives and getting away from the grips of addiction.